Look, I've been seeing patients for 15 years, and I'm going to be honest with you, the way I'm honest with everyone who sits in my chair. If your face is aging faster than the woman next door, it is not your genetics, and it is not your fault. But that cream on your nightstand is not going to fix what's happening underneath. What's actually going on is this. After 50, your estrogen drops, and that one shift quietly triggers a collapse in 3 layers beneath your skin. Your collagen starts breaking down, the fat pads that give your face its shape start sliding downward, and the bones underneath, yes, the actual bones, start to shrink inward. I call it accelerated dermal matrix collapse. And the reason nobody has explained this to you before is because most people are still treating the surface when the problem is structural. The good news, and I mean this clinically, not just to make you feel better, is that every single one of these mechanisms is reversible, and I'm going to walk you through exactly how, right now. Root factor 1, chronic subclinical dehydration. The first factor is one that almost every woman I have ever seen in a clinical setting has dismissed immediately, and that dismissal alone has cost her years. You think you are not dehydrated because you are not thirsty. That thought is exactly the problem. After 50, the thirst mechanism, the biological signal that tells you your body needs water, becomes significantly blunted. Your brain is no longer accurately reporting your hydration status to you. So you feel fine, you drink your coffee in the morning, maybe some tea in the afternoon, maybe a glass of water with dinner, and your body is running on a slow, silent, daily fluid deficit that you cannot feel. Here is what that deficit does to your face. Beneath your dermis sits what is called the extracellular matrix, simply means the gel-like scaffolding that surrounds your skin cells and gives them structural support and plumpness. This matrix is approximately 70% water. When it is chronically underhydrated, it compresses. It thins. It loses its ability to hold the skin layers apart from one another. Fine lines that are invisible in a fully hydrated matrix become permanent-looking creases within months. A study published in the journal Skin Research and Technology found that increasing daily water intake by just 2 liters over 4 weeks produced measurable increases in skin density and reduced surface roughness in women over 45. 2 liters. That is 4 standard glasses more than most of these women were drinking, and the timing matters enormously. Coffee, which most women drink within 30 minutes of waking, is a diuretic, simply means it pulls water out of your tissues before your cells have had a chance to rehydrate from the overnight fast. Here is your solution, and it costs almost nothing. Every single morning before your coffee, before anything else, drink 500 milliliters of water, that is 2 standard glasses, with 1/4 teaspoon of sea salt and a fresh squeeze of half a lemon stirred in. The salt restores the electrolyte balance, simply means the mineral ratio, that allows water to actually enter your cells rather than pass straight through. The lemon adds a small but meaningful dose of vitamin C to kickstart morning collagen activity. Do this every day. It takes 90 seconds. That one habit done consistently for 30 days changes the baseline hydration of your dermal matrix. And a hydrated matrix reflects light differently. People will notice, and they will not know why. The next factor is one your doctor has almost certainly never connected to your face, and it is hiding in the way you cook your food. Root factor 2, dietary advanced glycation. End products. I want you to think about the last time you ate something golden brown and delicious. Roasted chicken skin, toast with a deep caramelized edge, fried anything. What you were eating, beyond the flavor, was a class of molecules called advanced glycation end products. We call them AGEs. You might think, what does the way I cook my food have to do with the skin on my face? Everything. Absolutely everything. Here is the biological chain of events. When proteins and sugars are cooked together at high heat, roasting, frying, grilling, baking until brown, they bond together into AGE molecules. When you eat these molecules, they enter your bloodstream and begin doing the same thing inside your body that browning does to food. They bond to your collagen fibers. This process is called glycation, simply means sugar molecules permanently attaching to and stiffening protein fibers. Your collagen strands, which need to be flexible and spring-like to keep skin lifted, become rigid, brittle, and cross-linked. Simply means tangled and locked together like old rubber bands that can no longer stretch. Research published in the Journal of the American Academy of Dermatology identified glycation as one of the primary drivers of accelerated skin aging in postmenopausal women, with women consuming high-age diets showing skin aging profiles up to 35% more advanced than age-matched women on low-age diets. 35%. That is years of difference sitting on the same face. Why do standard anti-aging treatments fail here? Because no cream, no serum, and no facial treatment can uncross-link glycated collagen. Once collagen is glycated, that fiber is compromised. The only intervention that works is reducing new age formation and supporting the production of new, healthy collagen fibers to replace the damaged ones. Your kitchen solution is two things used together. First, 1 tablespoon of apple cider vinegar stirred into 200 milliliters of water, drunk 10 to 15 minutes before your 2 largest meals of the day. Research shows that the acetic acid in vinegar slows the glycemic spike, simply means the blood sugar surge, after eating, which directly reduces the raw material available for age formation in your bloodstream. Second, when you cook meat or vegetables, marinate them first in lemon juice or apple cider vinegar for at least 30 minutes before applying heat. Studies have shown this single cooking step reduces age content in the finished food by up to 50%. You are not changing what you eat. You are changing how you prepare it and what you drink before it. That is the difference. If you are finding this information genuinely useful, this channel exists entirely to bring clinical-grade knowledge directly to women who deserve to have it. Subscribe if you haven't already. Every video on this channel follows this same standard of evidence. Root factor 3, chronic cortisol elevation. This next factor is the one that in my 15 years of practice I have seen cause the most confusion, because it does not look like a skin problem at all when it walks through the door. It looks like a life problem, but it is destroying your face from the inside. Chronic stress. Not acute, dramatic stress. The slow, daily, background hum of worry, overscheduling, poor sleep, and emotional load that most women over 50 have normalized completely. I know what you are thinking. Stress ages everyone. That is just life. But what most women do not know is the precise biological mechanism. And once you understand it, you will stop dismissing this factor. When cortisol, simply means your primary stress hormone, remains chronically elevated, it directly suppresses the activity of fibroblasts. Fibroblasts simply means the specialized cells in your dermis whose entire job is to manufacture collagen and elastin. Elevated cortisol essentially tells your fibroblasts to slow down and stop. It also increases an enzyme called matrix metalloproteinase, simply means a protein-degrading enzyme, that actively breaks down existing collagen. So chronically elevated cortisol is doing two things at once: stopping new collagen from being made and destroying the collagen you already have. A study in the journal Psychoneuroendocrinology measured skin collagen density in women with chronically elevated cortisol compared to age-matched women with normal cortisol levels and found a 40% reduction in collagen density in the high cortisol group. 40%, not from age, from stress hormones. The common response, a face cream, a collagen supplement, fails here because the fibroblasts receiving the cortisol signal will not respond normally to nutritional input while the hormonal suppression signal is still active. You cannot out-supplement a cortisol problem. You have to address the cortisol itself. Your solution is magnesium, and specifically, the 2 most bioavailable food sources you can get at any grocery store. Every evening, eat 2 tablespoons of raw pumpkin seeds and 1 square, approximately 10 grams, of dark chocolate that is 85% cacao or higher. Together, these provide approximately 150 to 180 milligrams of highly absorbable magnesium. Magnesium is the primary mineral that modulates cortisol clearance, simply means helps your body break down and remove cortisol, and supports the slow-wave deep sleep phase during which your fibroblasts do their most active collagen repair work. Do this every evening, 30 minutes before bed. The next factor surprises almost every woman I tell it to, because it is not about what goes into your body. It is about what is not moving through it. Root factor 4, facial lymphatic stagnation. Here is something that almost no one in aesthetic medicine takes the time to explain. And it is one of the most visible contributors to an aged, heavy, sagging facial appearance, especially in women over 50. Your face has no pump. Your heart pumps blood through your circulatory system continuously. But your lymphatic system simply means the network of vessels responsible for draining fluid, waste products, and inflammatory molecules from your tissues has no dedicated pump at all. Lymph moves only through 2 forces, muscle contraction and gravity. You might think, I move every day. I am not completely sedentary. But the muscles that pump lymph through your face and neck are very small, very specific, and are almost never activated by normal daily movement. Combined with a lifetime of sleeping on your side or stomach, which pools lymphatic fluid in your facial tissue against gravity all night, most women over 50 are carrying measurable chronic lymphatic congestion in their face. This congestion does 2 things. First, the accumulated fluid causes low-grade, persistent puffiness that physically stretches the skin over months and years, the same way that repeatedly overfilling a balloon eventually prevents it from returning to its original shape. Second, the stagnant lymph is full of inflammatory cytokines. Simply means molecular signals that promote tissue breakdown, sitting directly adjacent to your collagen and elastin fibers, degrading them continuously. Research from the International Journal of Cosmetic Science found that 8 weeks of regular manual lymphatic drainage of the face produced a statistically significant improvement in skin elasticity measurements and a visible reduction in facial puffiness in postmenopausal women. 8 weeks, with hands only. Why do most treatments miss this? Because firming serums and tightening creams work at the surface. They cannot drain fluid from inside the tissue. You need movement and you need gravity working for you, not against you. Your solution: every morning after washing your face, apply 3 to 4 drops of castor oil to your fingertips, specifically your ring fingers, which apply the lightest pressure. Starting at the center of your face, use slow, deliberate strokes moving outward and then downward toward your neck, always ending at the lymph nodes just above your collarbone. This takes 3 minutes. 3 minutes every morning. Castor oil has been shown in multiple studies to have anti-inflammatory properties in superficial tissue and acts as a glide medium that allows deep enough pressure to move lymph without damaging delicate facial skin. Adjust your sleep position where possible toward back sleeping with a thin, firm pillow to allow overnight lymphatic drainage with gravity rather than against it. What comes next is a factor that nearly every woman is getting wrong. Not because she isn't trying, but because the clinical threshold she needs is far higher than anyone ever told her. Root factor 5, vitamin C deficiency at the tissue level. You are almost certainly getting enough vitamin C to avoid scurvy. Congratulations. But after 50, that is an almost meaningless benchmark for your face. Here is the distinction that changes everything. There is a difference between the level of vitamin C required to prevent deficiency disease and the level required to sustain active, premenopausal equivalent collagen synthesis in postmenopausal skin. Most women over 50 are in the gap between those two thresholds, not sick, but not building. Not deficient enough to feel it, but deficient enough for their face to show it. Here is why vitamin C is non-negotiable for collagen. Inside your fibroblasts, collagen is assembled as a triple helix. Simply means 3 protein chains wound around each other like a braid. This braid can only be stabilized by an enzyme called prolyl hydroxylase. Simply means a molecular stapling enzyme that locks the collagen structure into its functional shape. Prolyl hydroxylase cannot function without vitamin C as its cofactor. No vitamin C at the tissue level means the collagen your fibroblasts are producing is structurally unstable. It forms, but it is weak. It degrades faster than normal. It cannot provide the tensile strength, simply means the resistance to stretching and pulling, that keeps your skin from sagging. A clinical study published in the American Journal of Clinical Nutrition found that for every 1% increase in plasma vitamin C concentration in women over 50, there was a measurable reduction in skin wrinkling and dryness scores. Plasma concentration, not dietary intake, but what is actually circulating in the blood, is what matters. Common vitamin C supplements in pill form have an absorption ceiling, simply means a point at which your gut stops absorbing more, regardless of dose, of approximately 400 to 500 milligrams at any single sitting. Above that threshold, the excess is excreted, but food form vitamin C, consumed with fat, is absorbed more efficiently and sustains plasma levels for longer. Your solution is one of the most cost-effective nutritional interventions in this entire video. Eat half of a raw red bell pepper every single day. Half a raw red bell pepper contains approximately 95 milligrams of vitamin C, in the form most bioavailable to your tissue, and costs less than $1. Eat it alongside a small amount of healthy fat, a few slices of avocado, a drizzle of extra virgin olive oil, or a small handful of walnuts. The fat increases absorption across the gut lining significantly. Additionally, brew 1 cup of green tea, allow it to cool completely, and use it as a final facial rinse after your morning cleanse. Green tea contains a compound called EGCG, simply means epigallocatechin galate, which has been demonstrated in dermatological research to directly stimulate collagen gene expression in human fibroblast cells. It does not replace internal vitamin C, but it works synergistically with it at the tissue level. Now I'm going to give you the exact protocol, week by week, morning and evening, that integrates everything we have covered into one system. not a list of tips. A system. The difference between a list and a system is that a system has an order, a timing, and a compounding effect. Each element supports the others. Miss one and the others are less effective. Follow all of them and the results compound week over week. Week 1. Cellular foundation reset. Every morning, wake up and before coffee or food, drink 500 milliliters of water with 1/4 teaspoon of sea salt and the juice of half a lemon. This is non-negotiable. This happens before anything else. Every evening, take 1 tablespoon of apple cider vinegar in 200 milliliters of water 15 minutes before your largest meal. Take a photo of your face in the same lighting, same position, every Sunday morning. You need a baseline. Your eyes will adjust to your face daily and you will miss the change. The camera will catch it for you. Week 2, collagen synthesis activation. Add to your morning routine. Eat half a raw red bell pepper with a drizzle of olive oil alongside breakfast. Brew 1 cup of green tea overnight in the refrigerator, and after your morning face wash, apply it to your face with a cotton pad and allow it to air dry before moisturizer. This takes 40 seconds. Add to your evening routine 10 grams of 85% dark chocolate and 2 tablespoons of raw pumpkin seeds 30 minutes before sleep. Begin sleeping on your back where possible with a firm, thin pillow positioned under your neck rather than your head, so your face is neutral and lymph can drain naturally overnight. Week 3, lymphatic activation. Add to your morning routine immediately after the green tea rinse. Apply 3 to 4 drops of castor oil to your ring fingers. Using slow, deliberate strokes, massage outward from the center of your forehead, outward from the center of your nose across your cheeks, and then downward along your jaw and neck toward the collarbone. 3 minutes every morning. No exceptions. Add the apple cider vinegar marinade before cooking any meat or root vegetables. Marinate in apple cider vinegar or fresh lemon juice for a minimum of 30 minutes before applying heat. Week 4, system integration and bonus technique. Everything from weeks 1, 2, and 3 runs simultaneously. This is your baseline daily routine now, not a protocol. It takes less than 12 minutes total per day. Bonus technique, the ice bloom method. This is not in any of the 5 factors. This is extra. Every morning in week 4, fill a large bowl with cold water, add 8 to 10 ice cubes, and steep 2 green tea bags in it for 3 minutes. Then submerge your entire face for 30 seconds. Lift, breathe, repeat once more. The cold thermal shock causes vasoconstriction, simply means temporary tightening of blood vessels, followed by rapid vasodilation, simply means a flood of oxygenated blood rushing back into the tissue, which over 8 weeks of daily practice has been shown in cold water immersion research to produce measurable improvements in skin elasticity scores. The green tea in the water adds a topical EGCG dose simultaneously. Cost, 0. Time, 4 minutes. Effects, immediate firmness you can see the same morning and cumulative collagen support over weeks. This entire protocol, from the morning electrolyte water to the ice bloom, takes 15 minutes total, split between morning and evening. That is your system. Now I need to talk to you about something important, because everything I have just explained does not affect every woman equally, and the decade you are in right now changes which of these 5 factors is hitting you hardest. If you are in your 40s, your estrogen is declining but not yet absent. Cortisol sensitivity and glycation are your 2 most aggressive drivers at this stage. Your fibroblasts are still highly responsive, meaning the collagen synthesis interventions in this protocol will produce relatively fast results if you start now. If you are in your 50s, facial fat pad migration and lymphatic stagnation become your primary visible problems. The structural volume loss is accelerating. The lymphatic drainage massage and the sleep position change are the highest priority items for you. If you are in your 60s, periosteal bone resorption, the inward shrinking of your facial bones, has become a significant contributor to your facial appearance. Vitamin C at the tissue level becomes critically important because it supports not only collagen, but also bone matrix protein synthesis. Drop your age in the comments right now. Not for vanity, because I want you to know which of these 5 factors deserves your most urgent attention based on your decade. When you see my response in the comments, that information is specifically for your biological stage. Let me bring everything together. There are 5 root factors driving why your face may be aging faster than your neighbors, and none of them are your genetics. Factor 1 is chronic subclinical dehydration, corrected by the morning electrolyte water ritual every single day. Factor 2 is dietary ages from high heat cooking. corrected by the apple cider vinegar pre-meal drink and the marinade cooking method. Factor 3 is chronic cortisol suppression of fibroblasts, corrected by the evening magnesium protocol with pumpkin seeds and dark chocolate. Factor 4 is facial lymphatic stagnation, corrected by the 3-minute castor oil drainage massage and adjusted sleep position. Factor 5 is suboptimal vitamin C at the tissue level, corrected by daily raw red bell pepper with fat and the cooled green tea facial rinse. Together, these 5 elements are not a list of tips. They are one system, targeting collagen production, collagen protection, fluid drainage, cellular hydration, and structural nutrition simultaneously. Each one amplifies the others. That is what makes this different from anything you have tried before. One important clinical note before we close. If you notice rapid and sudden facial volume loss concentrated in one area, persistent one-sided facial swelling that does not respond to position change, or new asymmetry that appeared within days rather than months, please seek immediate medical evaluation. These can be signs of conditions that require clinical assessment beyond lifestyle intervention. This protocol supports your body's natural regenerative function. It does not replace a clinical diagnosis. No clinic will walk you through what I just gave you, because there is no billing code for it. There is no procedure, no product, no appointment to schedule. This channel exists for one reason: to give women over 50 the clinical-grade information their bodies deserve in language they can actually use with tools they already own. I am Dr. Elena Voss, and after 15 years in clinical practice, the thing I am most certain of is this: what you see in your mirror is not a flaw. It is a signal. Your body is telling you exactly what it needs, in the clearest language it knows. Now you can answer it. If this video gave you something real, share it with one woman in your life who needs this information. That is not a favor to this channel. That is a gift to her. Subscribe so she can find the rest of it when she's ready. I will see you in the next one.